Order, order. Esther McVey to move the motion.
I beg to move the motion that this House has considered attention deficit, hyperactivity disorder, diagnosis, waiting times. And it's a pleasure to serve under your chairmanship today, Ms Noakes, and an honour to open this debate to recognise the importance of early diagnosis of ADHD and to draw attention to the current severe delay in the diagnosis of it. An early diagnosis of ADHD will have a significant impact on that individual's life, their development, their self-confidence, self-awareness, and their physical and mental well-being. For someone with ADHD, a diagnosis can help them understand why they are struggling with life. It allows them to understand their impulsivity, their hyperactivity, their inattention, their sensitivity to the simplest of distractions, even to everyday noises. So instead of having a life feeling lost and alone, they can find and understand themselves, so having a feeling of belonging and control. It is believed that 1 in 20 adults in the UK have ADHD, according to ADHD Foundation, but only 120,000 have had a formal diagnosis. The charity said this is because of a combination of poor understanding of the condition, stigma, and delays in diagnosis. And diagnosis is essential, especially when there is an identifiable link between ADHD and suicide, when 1 in 10 boys and 1 in 4 girls who have ADHD attempt taking their own life. An early diagnosis could prevent these tragedies and offer an answer to those suffering from the condition. Now, today's debate has come about because of the tenacity of a constituent of mine, Tanya Bardsley. She has been open about the amount of pain that ADHD has caused her, her difficulty getting the condition diagnosed, and in particular the added difficulties for girls and women to be diagnosed. And she allowed herself to be filmed last year and shared it as an ITV documentary, Me and ADHD. Today, Tanya is a very accomplished woman. She runs 4 businesses, a charity, a household. Tanya is a mum and a wife. But it took her almost 40 years to understand her anxiety and depression, her impulsivity. In fact, it took her to almost 6 weeks before her 40th birthday to get diagnosed. Tanya described her ADHD as like having 17 TVs on in your head. You can't focus, and there's lots of noise going on in your head. You feel like you're being smothered, overwhelmed, like you're drowning in life. You're living with this inner restlessness, which is exhausting and relentless. So much so that even before Tanya was 15 years of age, she had tried to take her own life 3 times. And so, from the age of 18, Tanya was given antidepressants for depression and anxiety. Tanya saw over 20 doctors who just kept changing her prescription, but the medication never worked. It wasn't until she eventually went to see a private psychiatrist who specialises in anxiety, who diagnosed her with ADHD. Once Tanya got her diagnosis, she said, "I finally know what's wrong with me. After years struggling on lots of different medications, it's only now that it all makes sense. To be honest with you, I've never felt better." Tanya's diagnosis was very late, and it is why she is making it her mission, along with others, that diagnosis of ADHD needs to be done much earlier in life, in early years and in education. ADHD was first mentioned in 1902 when a British paediatrician, Sir George Frederick Still, found that some children were affected, that they could not control their behaviour, the way a typical child could. He also noted, but it wasn't because they weren't intelligent, it was because they couldn't control themselves. Over the last century, the understanding of ADHD has increased, as has the diagnosis and treatments. It is defined as an ongoing pattern of inattention and or hyperactivity, impulsivity that interferes with functioning or development. And in 2000, 3 subtypes of ADHD were recognised and are now used by healthcare professionals. That's combined type ADHD, predominantly inattentive type ADHD, and predominantly hyperactive impulsive type ADHD. And in inattention, you need to prove 6 or more symptoms of inattention for children up to the age of 16, or 5 or more for adolescents aged 17 and older, and adults. Symptoms of inattention have been present for at least 6 months, and they are inappropriate for their development level. And this is things like often fails to have close attention to details, careless with homework or work or other activities, has trouble holding attention in tasks or play, often doesn't seem to listen when spoken to directly, and often does not follow through on instructions and fails to finish chores, homework, and has trouble organising tasks and activities. I do indeed, and I do believe the Minister will respond in a positive way. And as well as that inattention, as well as this early diagnosis that we're both saying is important, there is that hyperactivity and impulsivity. And this too needs to be seen and recognised. And it's 6 or more symptoms of that hyperactivity, impulsivity for children up to the age of 16 years. Or it is 5 or more for adolescents aged 17 years and older and adults, and symptoms of hyperactivity and impulsivity have been present for at least 6 months to an extent that it is disruptive and inappropriate for that person's development level. And this means they fidget, tap hands or feet or squirms on a seat, often leaves the seat in situations where remaining on the seat would have been expected, often runs or climbs in situations where it's not appropriate, often unable to play or take part in leisure activities quietly, and is often on the go, driven by a motor, and talks excessively. In addition, the following conditions must be met by several inattentive or hyperactive impulse systems which were present before the age of 12. Several symptoms are present in 2 or more settings, whether that's at home, school or work, with friends, relatives, or in other activities. And there is a clear evidence that the symptoms interfere with or reduce the quality of social, school or work functionings. And the symptoms are not better explained by another mental disorder. So we've got there quite strict conditions that need to be met, and we know what the symptoms are. And as my honourable friend has said, this needs to be diagnosed early. We know these conditions have been there before the age of 12. In fact, that's what it stipulates, before the age of 12. Therefore, it needs early diagnosis. And to be able to get a diagnosis early on for a child, there needs to be a clear pathway for those referrals from the school, from the GP to the specialist, and that at present is not working swiftly enough. Essential, as data would suggest, the number of people in the UK affected by ADHD is 2.6 million people. That's according to the ADHD UK website. 708,000 of those are children and 1.9 million are adults, with over 117,000 individuals in the UK receiving a prescription for ADHD medicine. Now, whilst I noted in the papers only this week, there were concerns from some in the scientific and medical profession of over-diagnosis as parents and individuals turn online to self-diagnose. I would say that's possibly because they haven't been able to see a GP or go to a specialist. They've turned themselves online to self-diagnose. So yes, there could be an over-diagnosis there, but I will say the bigger concern is under-diagnosis of those who need it, and why we need this rapid access to a professional to establish what it is they've got and what is the treatment that they need. Note too, the journey for girls and the outward signs for them is very different than it is for boys. And as such, ADHD tends to be picked up in boys and not so much picked up in girls. The symptoms of boys are more well known. They display this sort of naughtiness, a disruptive way of acting, being the class joker, trying to disrupt others, and that gets them noticed. However, the symptoms for women and girls is not one of being naughty. It's more with one, and I put this in quotation marks, being away with the fairies, distracted in a way. Their behaviour, due to the fact that it's non-disruptive, means that they don't get the attention they deserve, therefore they remain untreated. Now, how it impacts the lives of those with ADHD is very different, and they all cope with it very differently. However, the impact of ADHD is significant. Adults with ADHD are 5 times more likely to try and take their own life than those without it. This is a tragedy in and of itself, and why that diagnosis needs to be there. Knowing the impact ADHD has on people's lives, it is what Tanya is calling for. It's what lots of other people are calling for. It is this early diagnosis. For Tanya, she was diagnosed when she went private, a luxury that most of my constituents don't have because they can't afford it. The process is usually a 60 to 90 minutes consultation with a psychiatrist. There isn't a scan. There isn't a diagnostic test as such. You do need to meet somebody who can look at the conditions that you have. However, even if the referral is made by a professional, they may risk being screened out. And thanks to ADHD UK, I have some local data from Cheshire area regarding this screening out of the referrals. And this could be because screening is not part of the NICE guidelines and blocks people from assessment. But blocking people out from assessment, despite a qualified referral, does not make sense, as we know it will stop people getting the care that they need. And in the last 3 years, part of Cheshire had up to 84% of girls put forward for assessment removed by an assessment from the local health authority, despite girls being known to be underdiagnosed and despite the higher suicide risks that these young girls have. So in order to obtain this information, ADHD UK had to submit an FOI request to each individual integrated care boards, and that's how we found out the information. But it is significant, it is sizable, and it does need to be sorted out. So my questions for the Minister is, first, will she meet with me and my constituent, Tanya Bardsley, to discuss ADHD and what steps the government can take to ensure earlier diagnosis, and two, for the government to ensure a national data collection, as is the case for autism, and for there to be an ADHD waitlist dashboard, as there also is for autism. So I'd like to thank the Minister for her time today, and also ADHD UK for all their hard work in getting this data about Cheshire to me, and of course to Tanya Bardsley.
The question is that this House has considered attention deficit hyperactivity disorder diagnosis waiting times. Minister.
Thank you, Ms Noakes. It's a pleasure to serve under your chairmanship. And can I start by thanking the Right Honourable Member for Tatton for securing this important debate. I believe there are 2 more debates on this specific issue next week in this chamber, and so I think she's leading the way in securing this debate as a starter for further consideration. This is a really important issue. We know that people with ADHD have positive traits and strengths and abilities such as creativity, resilience, and the ability to hyper-focus. And I think the Right Honourable Lady, in referring to her constituent, Tanya Bardsley, has shown that people with ADHD can be extremely successful, but there's challenges as well, and I think she set that out really clearly for us all. Firstly, in terms of living with ADHD, but in getting a diagnosis, which is often necessary to get the support that people need. And I'm not going to come here and pretend that there isn't a problem in terms of accessing assessments at the moment. And many of my constituents also come and see me around that, and many do have to go privately in order to get a diagnosis, and that isn't acceptable, and I fully acknowledge that. NICE, who are the body that provides the evidence-based guidance for commissioners and providers, do say that they should have due regard to the evidence base when designing and commissioning services. And but there are a number of key issues that she's highlighted herself in hampering the progress in which patients, families, are accessing services, because NICE doesn't actually recommend a maximum waiting time for a diagnosis, so there is no benchmark, there is no gold standard to measure services against, and that is something that that does mean that services sometimes struggle to meet a kind of what we would consider an acceptable waiting time for assessment. The NICE do set out considerations as to who should make the diagnosis and the criteria for diagnosis, but the long waits are due to the fact that there is no benchmark for how long a maximum waiting time should be. The second issue, which she also highlighted, is the national data set for ADHD waiting times. There is no national collection for data, and I note that she said the charities have gone to each ICB, and it's encouraging in a way that that data is there, But we need to nationally pull that together so we have oversight and, as she describes, a waiting list dashboard that we can see, not just to see what's happening in terms of best practice, but also where there's gaps in certain parts of the country that may have longer waiting times than others. And I'm certainly happy to pledge to her that this is something that I will look at because we are doing so much work in this area at the moment. For decades, mental health services, neurodiversity have always been the Cinderella service in health, with physical health being much more predominant. We are making that change now with the parity of esteem for services, but there is a lot of work to do in order to catch up. And waiting times, standards and data to be able to measure that is a key part of that as well. As she set out, diagnosing ADHD is challenging because there is no definitive test for it. There are a number of indicators that she set out that it could indicate an assessment is needed, but it does need someone to be seen, to be assessed to determine if that is the case. But ADHD also often exists in conjunction with other conditions whose symptoms can overlap and mask those of ADHD. And the NICE guidelines aim to improve the diagnosis and the quality of care and support that people with ADHD receive. They also do recognise that ADHD is underdiagnosed in women and girls, and that the indicators are very different. And certainly with my work in mental health, we do see the consequences of that in terms of young women and girls being admitted into mental health inpatient facilities, and a higher rate of suicide as well. So she's absolutely correct in what she says. So there are a number of ways that we're trying to improve access to assessment and diagnosis. Many children and young people seek diagnosis now through CAM services, but there are pressures on that service too. And we are providing funding to increase access. And in the last financial year, there was £79 million allocated, which allowed 22,500 more young children and young people to access mental health services, because it's vital that we, as she eloquently said, we get those diagnoses as early as possible in a person's life so they get the support as soon as possible. We know that children with ADHD and with other neurodiverse conditions such as autism can thrive in and out of school if they get the support they need. One pilot that we're doing in Bradford is looking at an early diagnosis tool, and that trial is underway, which helps teachers, parents and others identify the needs of those with neurodiverse needs. And if successful, that Bradford trial could be expanded across the country, and I will update as soon as we have the results of that, because we're keen to see improvements in attendance, behaviour and educational outcomes in schools, and in the quality of life experienced by children and their parents. This tool is not intended to replace clinical diagnosis, but it should be able to support and make earlier support available to children and their parents while they wait for an assessment and a diagnosis. We also have the SEND green paper, which set out proposals to improve the outcomes for children and young people with special educational needs, which includes those for ADHD. And we're publishing a full response to the green paper in an improvement plan imminently, which I think she will hopefully feel that this addresses some of the issues that she's raised today. One of the best things that I've seen in terms of practical support is the mental health support teams that are now being placed in schools. We currently have 287 supporting 4,700 schools, which is around 26% of pupils. That will go to 35% of pupils in April. And what that does is support teachers to be able to identify children that may have ADHD, other neurodiverse conditions or mental health issues, and get them signposted into the system much quicker. And that is making a real difference on the ground, and we're keen to expand that service as quickly as possible. Because, as she said, children and young people with ADHD do suffer with higher rates of anxiety, nearly 50% higher than the general population. And that's why we need to get that support in as quickly and easily as possible. So I acknowledge that we are not where we want to be in terms of support for ADHD, either in terms of diagnosis, in terms of support, and in terms of access to assessments. And when we respond to the green paper, we will hopefully show that we are serious about changing this and making that support more easily available. The Bradford pilot study will hopefully again improve access to services, but the key is getting that data. And I do give a commitment today that we will look at the data both in terms of waiting times, but also a dashboard, because you cannot plan services if you don't know how many people are waiting for an assessment and then once diagnosed with ADHD, plan services to support them. So I completely acknowledge that point. I'm very happy to meet her constituent, Tanya Barsley. She sounds an amazing woman who has a lot, I think an expert by experience is very, very valuable indeed. So I know there is more to do to improve access to ADHD assessments, but I hope I've given reassurance that we take this very seriously indeed.